Hello, I'm Bankole Olatosi. I am the director of the Masters of Healthcare Administration program, also a clinical associate professor in health services policy and management in the Arnold School of Public Health. My prior experiences, I started my foray into public health over 10 years ago, working as the program manager for an HIV/AIDS counseling and testing center in Lagos, Nigeria. I then went into academia, and I've been in academia for the past 8 years in working in the field of public health and healthcare administration. Now, sometimes the question is asked, what is public health? I rather ask the question a different way. What is not public health? The water you drink, the car you're driving, the seat belts, even the current trends we have in obesity right now, it's all public health. So public health touches our lives in more ways than most people would ever imagine. Food and drug safety is public health. The hospital safety in the hospitals is public health. So there are a lot of public health. As a result of the wide spectrum that public health covers, public health also has a lot of players. And so while in the School of Public Health we have different programs from epidemiology to health promotion, education and behavior, to health services policy and management, biostatistics, we all work together to ensure the health of the public. And that can be seen even today as we are having more discussions about population health. And population health is really a function of public health. Finally, in healthcare, we've come to realize and recognize that we cannot ensure the health of the population by simply treating them in hospitals and clinic settings. We have to do better, which is the prevention portion of before the patient gets into the hospital bed. So one of my roles today is to talk about how we all need to partner and function towards the one goal that we have of ensuring the health of the public. A lot of discussions now is on the triple aim, and the triple aim in healthcare is really focused on public health or population health. So, for example, we do require the epidemiologists to do surveillance when we have food investigation going on or foodborne illness happening, so we can trace the source of the contamination coming to the water system. Sometimes the contamination can come from E. coli, washing the vegetables, things that we want people to eat, but also want them to eat it safely. So the water inspectors, the people who are watching that, the health promotion, education, behavior folks, the regulators, the policymakers, all play a role in ensuring that the salad gets to the table taint-free, disease-free, or infection-free. So, you can see that partnership also happening in that regards. From a population perspective, one of the biggest cost trends in healthcare is really based on lifestyle, and lifestyle related to conditions like obesity, which are health promotion, education and promotion behavior professionals work on from an early stage to get our children healthy, to get adults healthy, to change lifestyle, to rather than drinking a big ounce of soda, to drink water and do things like that. And so in doing that, the health promotion behavior activists, the epidemiologists, even the Masters in Healthcare Administration professional who helps maintain the hospital system, keep it free of infections, quality control, and helping to ensure the health of the public, all work together in that light to do public health. So again, going back to my comment, it really is not a definition of what is public health, it's more of what is not public health. So we're all in this together across different fields, trying to work together to ensure the health of the public. Now public health leadership, we are all in this together, and as a result, We need to, even in our different silos of programs, consider the impact we have on the health of the public. So I'll start from my program-specific viewpoint. If a patient comes to the hospital and gets discharged or treated in the hospital, the treatment does not stop there. We're going to transition that patient back into the community, and if we don't want that patient readmitted back into the community, we really need leadership in terms of the community leaders, or the policymakers, or the regulators making available the environment for that patient not to become readmitted. So for example, let's say we have a patient who's obese and we've treated for congestive heart failure, and we need to get them exercising and eating healthy. It's a function of having our health promotion, education, behavior colleagues provide the data and information to policymakers on the need and necessity and the benefits of having safe walking trails. Sometimes policymakers don't understand why I need to make an investment in a safe walking trail until they recognize that it does impact the health of the population. And so by our HBB colleagues showing leadership there, we can actually change the environment that will keep our populations healthier. Or talking about, for example, our discussions about fast foods and giving options to people, affordable options, so that no one is left out just because of income level, and allowing people to be able to buy a salad for $1, or getting people to understand the need why we want to do that. So it's all of us coming together and showing leadership in each point of our workplace in public health, because we are working together to ensure the health of the public. And that leadership is working together is the only thing that would get us to the point that we want to be. So parting thoughts, whether you're an epidemiologist, whether you're a health promotion behavior specialist, whether you're a hospital administrator, whether you're a biostatistician, all of us have a collective responsibility, individually first, and then as a group, to provide leadership and explain and use data and use examples to show what the benefits are of any intervention or any regulation or any policy that we need to enact to safeguard the health of the public.